Anna Kay is 2 years old and has inhaled a peanut. It's fairly common for children to inhale foreign objects. From 2013 to 2014, there were 18,618 admissions resulting from a foreign object entering the body in England. Almost 60% of these were male, and around 70% of the total number of admissions were classed as emergency admissions. Around 4,000 of these cases presented in children under the age of 5. This is approximately 1/5 of the total number of admissions. The most common places in the respiratory system for a foreign object to get lodged is the larynx, trachea and bronchus. The peanut is stuck in Anna Kay's right bronchus. It's more common for an object to be stuck in the right bronchus than the left, as it has a greater diameter and the angle at which it comes from the trachea is smaller than on the left, as can be seen in the diagram. Signs and symptoms usually occur in 3 phases. In the first phase, the child is likely to be choking, coughing, gasping, and respiratory distress may develop due to an obstruction in the airway. Choking tends to last between a few seconds and several minutes after inhalation and may be self-limiting. In the second phase, the symptoms are followed by a temporary quiescent phase in which the child may not have any symptoms. During the third phase, symptoms of complications may develop. These could include symptoms of infection, such as an increased temperature. The clinical presentation will depend on the child's age, the type of object they inhaled, the location of the object, and the amount of time that's passed since they inhaled the object. The most common symptoms of a foreign object inhalation are coughing, choking, and wheezing. The child may experience little acute distress after the initial phase of choking. Choking in a previously healthy child is likely to be the result of a foreign body being stuck in their airway. Foreign body inhalation can closely mimic the symptoms of an acute asthma attack. However, with the absence of atopy, the acute onset of symptoms and the physical findings may suggest foreign body inhalation. Moreover, children who have inhaled a foreign body will fail to improve with conventional treatments for asthma. Complications tend to occur if the object has been stuck for a prolonged period of time. Some examples could be croup, pulmonary infections, and a pneumothorax. The main complication that can develop is complete airway obstruction. The diagnostic process will include looking at the medical history of the child as well as their family history. This can help to rule out conditions such as asthma. It will also include listening to breathing sounds. Sometimes X-rays and CT scans may also be used to aid diagnosis. However, these are more commonly used after the diagnosis of an inhaled object to pinpoint the exact location of the object in the respiratory system.